What exactly is trigeminal neuralgia?
And it is characterized by sporadic, sharp, lancinating like pain. Actually comes for few seconds and it can last for few minutes.
What exactly are the early signs and symptoms apart from just the pain?
Different from that normally that anyone can have, like headache, migraine. It's entirely different from that.
So, what exactly are the causes for?
This is the fifth nerve, trigeminal nerve, that carries the sensation over the face.
So then, how can a normal person characterize this kind of pain? That it is not a dental pain and that it is a trigeminal.
It is very severe type of pain because earlier era we used to call it suicidal disease.
With these kind of symptoms, like what is the procedure undertaken by the neurosurgeons?
First, we basis on symptoms, we identify, we make the diagnosis, clinical diagnosis, that is trigeminal neuralgia.
What is the recovery time after this kind of?
No, immediate after surgery. There will be immediate pain relief.
Hello everyone, welcome to 2050 Healthcare. Today we have with us Dr. Anil Sharma, who is a leading neurosurgeon working with AIIMS Raipur. Namaskar sir.
Namaskar.
So sir, today we will be discussing about trigeminal neuralgia. So what exactly is trigeminal neuralgia, sir?
Thank you having me here. So trigeminal neuralgia is one of the most dreaded and worst type of pain that anyone can have, facial pain that anyone can have, and it is characterized by sporadic, sharp, lancinating like pain, and that actually comes for few seconds and it can last for few minutes. And that is the worst type of facial pain that anyone can have.
So normally, what exactly are the early signs and symptoms apart from just the pain?
No, usually it presents with pain only. The pain is very characteristic in this kind of pain. It's different from that normally that anyone can have, like headache, migraine. It's entirely different from that. And this pain is very excruciating, severe, sharp, lancinating like pain. It comes in bouts, like there can be multiple episodes.
Okay.
And the pain it can be around the eyes. It's most of the time it's unilateral on one side of face. It can be around the eyes, around cheek, around lips and upper and lower jaw, and it usually lasts for few seconds, and that sharp shooting electric shock like pain. It's entirely different from that dull kind of headache that usually we see in the practice. So it's very characteristic and clinically it can be diagnosed.
So what exactly are the causes for?
No, usually
This,
usually what happens that this is the fifth nerve, trigeminal nerve, that carries the sensation over the face, that is responsible for sensation over the face. So when this nerve emerges from the brain stem, usually there is offending vessel, that that vessel is causing compression over the fifth nerve. And what happens after that compression over a period of time, that create a sort of electric short circuit like thing, and that leads to increased sensation, increased pain. That nerve get hyper excited, and after that we perceive that sensation. That is one cause, and sometimes it can be secondary to tumor, any vascular pathology, and even multiple sclerosis. That can be the cause.
Sir, is it a myth that most of the time this trigeminal neuralgia is detected by dentists?
No, actually what happened that symptoms usually that it start around the jaw, upper and lower jaw, and it can happen in teeth also. So that usually the patient, they usually go to dentist first.
Right.
And if even I have seen many a time, like people who are coming after many years taking some treatment, and they come with multiple dental procedures.
Oh.
That was done unnecessarily because diagnosis was not done. They come with multiple dental procedure like tooth extraction and multiple root canal procedures. So yeah, because that area is that upper and lower jaw and the tooth, that area is there. So they usually sometimes they go to dentist first.
So then how can a normal person characterize these kind of pains, that it is not a dental pain and that it is a trigeminal neuralgia
Because this pain is very characteristic, that as we discussed earlier, it is very severe type of pain, because earlier era we used to call it suicidal disease. In earlier time.
Okay.
So we can that looks quite insensitive, but like we can perceive the fact like how severe this pain can be. It's very severe, very excruciating, and it lasts only for few seconds, and in between patient will be normal. And what happen in any act we do, like brushing of teeth, like chewing of gum, even simple bend of that breeze, that can aggravate the pain. That can be the trigger factor.
So it's very sensitive.
It's very sensitive. While saving, chewing, and eating something,
Right.
and even the simple that air and that wind, that can aggravate the symptoms. That can aggravate that can be the trigger factor for pain. That is the thing. So it's quite characteristic pain, and it's very unusual to miss this, because it's quite characteristic. Quite characteristic.
Sir, like whenever a patient approaches with these kind of symptoms, like what is the procedure undertaken by the neurosurgeons?
So usually we take detailed clinical history. First, we like basis on symptoms. We make the diagnosis, clinical diagnosis, that is trigeminal neuralgia, and then we do MRI brain with some special sequences to look that compression over the fifth nerve. So we need to do some special sequences, that is called CIS or Fiesta scan, and at the same time we need to rule out like whether there is some tumor or multiple sclerosis or some vascular pathology, vascular malformation that is causing compression over the fifth nerve and causing symptoms. That also we need to rule out. So we do MRI scan, and after that we diagnosed.
Sir, post diagnosis, like do most of the cases require surgical intervention?
This is very interesting and very good thing to know, because the first treatment of trigeminal neuralgia is medical management. So first we put a patient on medical management, but we need to understand that usual type of analgesic we do use, like for paracetamol, and
Right.
so these medications do not work for trigeminal neuralgia,
Okay.
because that pathology is different, that pathophysiology and mechanism of pain is different. So we routinely use anticonvulsant like carbamazepine and oxcarbazepine. So these kind of drug we use. And what happened over period of time, either patient develop tolerance to these medications, or there are side effects due to high dose.
Okay.
So initially, that is also one characteristic thing, that initially almost all patients respond to medication. Initially they get very good relief, but over period of years, due to tolerance and that high dose of medication, they may develop side effect, or they may be tolerant to medications. So their pain can reappear, or they may need a higher dose, and that higher dose will cause side effect. So over period of time, like we can say, almost half of the patient respond to medications, and over period of time that medication can be stopped. And another half of the patient, those who are tolerant or developing side effect to medications, we need to intervene. Then we need to do surgical procedures for that.
Sir, like is it a very lengthy surgery for these kind of procedures, and like what is the recovery time after this kind of
No,
surgeries?
immediate after surgery, there will be immediate pain relief. Patient will be free of pain, and will be free of medications after
So
surgery.
there is no chance of recurrence in
No,
case of surgery?
that we cannot say. Like microvascular, there are various ways to deal with this kind of pain.
Right.
First, as we discussed, there is like medical management. So over half of the patient respond to these medications, and those who are not responding or become tolerant or side effect, then we need to choose surgical procedures. So one surgical procedure is microvascular decompression. So microvascular decompression is gold standard treatment. That is the best treatment available for trigeminal neuralgia. So in another treatment options are, we can give injection, but problem with injection, like we need to give multiple time, because chances of recurrence are more in injections. Injection image guiding injection we give through the cheek, at the place where nerve is exiting from the skull base. So we give injection over there, and that injection radiofrequency ablation that cause thermal injury, and that signal can be broken after that. So there will be pain will not be perceived, though there can be facial numbness, some kind of like पेशेंट बोल सकता है कि थोड़ा मोटा मोटा इधर लगता है या चेहरे पे फील नहीं होता है. So that can be the problem with that. But their chances of recurrence are more in these kind of procedure, and they may need to be repeated multiple times. And another procedure can be stereotactic radiosurgery. But gold standard, the most effective treatment is microvascular decompression. And chances of recurrence are very less. Chances of recurrence maybe 5 to 10%.
So then most of the cases, as you mentioned, then these kind of surgeries, post-hospitalization period won't be longer, right? For
Yeah,
these
usually
patients?
second day patient can be discharged, usually. And the interesting thing is that recovery will be immediate. Patient will be free, completely free of pain and free of medications immediately after surgery.
Sir, as you mentioned, this pain is really excruciating, as you also mentioned, suicidal. Right? So, most of the cases, does it ever happen that this imposes any kind of emotional trauma on the patient?
Yeah, that's definitely there, because pain is like this is described as most dreaded type of facial pain in the medical literature. So there are reports like there have been suicides and so many things after that, because the pain is and it alters the entire personality of the patient.
Okay.
Because what happened, like pain get, as we discussed, pain get aggravated after chewing, brushing. So patient is very full of anxiety. Like if I touch my face, that pain will get aggravated. If I chew something, the pain will get aggravated. If I'm brushing my teeth, if I'm doing saving, even simple that wind, that can aggravate the pain.
So there'll always been a fear.
Yeah, always a fear, and he or she does not know like that when that next episode will come back.
Right.
That is the thing. So all the time they are in anxiety.
Right.
So it all just alters and changes the entire personality. So it's very, very dreadful disease.
Sir, in these kind of patients, when they are in either the process of medication or maybe post-surgery, like does physiotherapy help them anyway in managing that pain?
Yeah, physiotherapy that can be done. That can help in patient for better recovery. Better recovery can be there after physiotherapy.
सर आपने जैसे सर्जिकल प्रोसेसेस के बारे में बताया, सो नॉर्मली न्यूरोसर्जन्स किस तरह के सर्जिकल प्रोसीजर्स अप्लाई करते हैं इस केस को डील करने के लिए?
हाँ, इसमें जो सर्जिकल प्रोसीजर रहता है दैट इज माइक्रोवेस्कुलर डिकम्प्रेशन. सो व्हाट वी डू, we just put a small incision behind the ear, few centimeter incision, and a small that bone removal, and then we identify the that conflict, that offending vessel which is compressing over the trigeminal nerve, either endoscopy or microscopically, that high definition endoscope or high resolution microscope. It's very ultra microsurgery type thing, and then we identify the offending vessel, and then we separate very carefully, because that is near to brainstem. Okay. And then we put a small piece of Teflon. Teflon is inert material. So that Teflon is placed, and that act as a cushion, so that pressure and that compression does not get transmitted to the nerve. So it's fairly very safe and a small procedure.
Sir, mostly it's a very pain-free surgery.
Yeah, it's pain-free surgery. It's pain-free.
Okay. Sir, lastly I would like to request you, so kindly help people out there understand, because there is a very thin line of difference between this kind of pain and the dental pain, and as you mentioned, some people get biased and they visit doctors, dentists frequently. So how can they differentiate and characterize these kind of pains and to reach a neurosurgeon at the right time so that they will get relief from this kind of a trauma?
Yeah, that as symptoms already as we discussed already.
Right.
So we need to identify these kind of symptoms, and if there are these kind of symptoms, then you need to consult a neurosurgeon or neurologist, and that further investigation can be done and further treatment can be started. And it's fairly treatable disease. There is no need for any kind of disappointment or stress. This is fairly treatable disease, and result of microvascular decompression are excellent. And there are other ways also, like sometimes if patient is not fit to undergo surgical procedure, or very elderly patient. So there are, like as we discussed, stereotactic radiosurgery or that radio frequency ablation. All those kind of treatment are also available.
So thank you so much for helping us understand this kind of a disorder, so that it will be really helpful for other people to get to the right person in the right time.
Yeah. Thank you.
Thank you so much.
Thank
sir.
you. Thank you for having me.